Welcome to An Apple a Day, a podcast, a resource, a community. Share your experiences and learn from others as we overcome barriers and learn to live a happy, healthy life with a disability. Welcome to the community. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day. But this is not a full episode. Nope, as Jimmy says. This is just a bite, a slice of the apple. Oh, and just in case you didn't realize, I'm not Jimmy. I know, it's hard to believe. I can't tell you how many times people mistake us for each other on the phone. Even my own girlfriend. Sometimes I feel like Rodney Dangerfield, but that's another story for another day. Anyway, my name is Dave and I'm filling in for Jimmy today. Unfortunately, he is home recuperating from a 5-week stay in the hospital for a stroke, 2 weeks in the medical hospital and 3 weeks in rehab. He's doing really well and has home therapists coming in for physical, occupational and speech therapies, as well as a nurse. Plus the fact that his own lovely wife is also a nurse. He's in really good hands and plans to be back behind the microphone very soon. So, how are you feeling today? Are you feeling better than you did yesterday? Excellent. You can't ask for better than that. Jimmy asked me to share a COVID update from here in New York. The New York State Department of Public Health said that new highly contagious variants, which are variants of the sub-variant, BA.2, of the Omicron variant, are responsible for rising COVID-19 cases in the United States. One of the new sub-variants reportedly has a mutation that can help it evade immunity, per the New York Times. It's unclear if that applies to natural immunity, immunity from vaccination or both. This is just to remind you that we still have to be on our toes and be vigilant when it comes to this nasty, disgusting, vile, and deadly virus. And just as a by the way, my girlfriend and I know Jimmy and his wife and family, wear the masks into public places, such as stores. We see many other people doing the same. It's my belief that it's better to be safe than sorry. I'd really hate to see someone get seriously sick. Or, God forbid worse because they felt it's an inconvenience to wear a mask in a public space. If it helps, think of it like this: you're not wearing the mask just for yourself. You wear it to protect others around you and your family at home. I know when I think of how many people are potentially protected by me wearing a mask, it doesn't seem like such a big inconvenience to put it on when I go into a store. Remember, the vaccines are not the be-all and end-all. Neither are the masks. But together, they make one heck of a weapon in the fight against COVID. Here's some good news from the Department of Social Security. This was written by Kilolo Kijakazi, Acting Commissioner of Social Security. I am pleased to announce that local Social Security offices restored in-person services, including for people without an appointment, on April 7, 2022. To avoid waiting in line, I strongly encourage people who can, to use our online services, call us, and schedule appointments in advance rather than walking in without an appointment. Phone appointments can save you a trip to a busy office. I thank the public for your patience as we work to increase service. Customers who walk in without appointments may encounter delays and longer waits at our offices. Before coming to an office, we encourage you to visit our emergency page to check the office status. Be aware that our offices tend to be the busiest first thing in the morning, early in the week, and during the early part of the month, so people may want to plan to visit at other times. Given that many of the people we serve have health vulnerabilities, and consistent with our union agreements, we are continuing to require certain safety measures including masking, regardless of local guidance, physical distancing, and self-health checks for COVID-19 symptoms. We will provide masks to the public and employees if they need them. Most Social Security services are available to the public online and with a My Social Security account, or by telephone. And most Social Security services do not require the public to take time to visit an office. People may create their My Social Security account, a personalized online service, on our website. Many Social Security services are also conveniently available by dialing toll-free, 1-800-772-1213. People who are deaf or hard of hearing may call Social Security's TTY number, 1-800-325-0778. As we transition to a new modern phone system, some people may experience a busy signal or be unintentionally disconnected from their call. We sincerely regret this disruption and recommend people call when our national 800 number may be less busy, such as before 10 a.m. or after 4 p.m. local time or later in the week. Like our offices, our waits are generally shorter later in the month. To learn more, please visit our How to Get Help from Social Security page and our online services page. Go to www.ssa.gov. This website address will be in the show notes for this podcast episode. As Jimmy says, there you have it. Coming up on An Apple a Day in May, we have some great guests and you will not want to miss meeting them. I'd like to thank you for stopping by today and giving me a shot at my first attempt as a podcast host. Well, at least as a fill-in. Remember this, things can always be worse. That's right. Right now, there is someone, somewhere, wishing that they were in your position. So, things can always be worse. This episode of An Apple a Day has been sponsored by Famous Apple Designs. Visit them for all of your Apple a Day gear, as well as novelties and gifts. Go to www.famousapple.com/gift shop. Thanks again for stopping by today and check back for updates. We'll talk again.
Thanks for listening to An Apple a Day with Jimmy Apple, your gateway to a happy, healthy life. Join our community at www.famousapple.com. See you next time.